Okay, here's everything that happened in medicine and healthcare today, and it is August 12th. Well, today there was a big study that came out of JAMA today talking about the risks again when it comes to something like GLP-1, also known as Ozempic. Essentially, they looked at individuals who were taking GLP-1 and were diabetic, over 1.5 million of them in the study, and then compared them to the other individuals who were diabetic and were taking normal medications. Essentially, what they found that individuals taking Ozempic were getting this thing essentially called an eye stroke at about a rate of 1 in 2,500, compared to the average of what we initially thought was about 1 in 10,000. So they're thinking maybe a little bit more than usual. There's a flesh eating bacteria on the rise in Florida and in Louisiana, and you should probably look out for it. The bacteria seems to thrive in warm, salty water, so individuals who have open wounds and individuals who eat lots of shellfish are at higher risk. While the rate is still pretty low in Florida, it's something that warning officials are recommend that you keep an eye out for, and if you have any symptoms of it, you should consider getting it checked out. Today, more than 11,000 bottles of spironolactone, a blood pressure medication that is 25 milligrams, was recalled due to potential contamination. And lastly, there was a report that came out that talked about physicians that are starting their own businesses, and they found that they are having a harder time because they're ending up spending more than what they end up making. They found that on average, places are spending about $660,000 per provider in order to provide care, and they're only bringing in about $440,000 per provider, so they're losing almost $200,000. Essentially, what they're saying is that the revenue per unit worked for physicians has been decreasing over time, making it harder for them to run their own practices. If you want a more in-depth analysis about anything that we talked about today, or if you just want to help support the channel, which I would love, you can find links for that in the bio, either to the Substack or for ways to support. I will see you tomorrow for the rest of the news.